Public service announcement. If you're a lady between the ages of 17 to 35, this video is for you. Fine girl, why have you not gone to do that lab test you wanted to do? Why have you been postponing? You have been having these symptoms, but you're just postponing it. Don't say I did not tell you, because right now I am about to talk about a topic that is the leading cause of infertility. It is the leading cause of infertility because most women do not find out that they have this infection until when it is time for them to start having kids. And then when they are looking for what could possibly cause temporal infertility, they find out that it was something that they could have avoided. I am talking about no other thing than pelvic inflammatory disease. As a lady, you might have been hearing about pelvic inflammatory disease, what it could mean. In this video, I want to explain everything you need to know about pelvic inflammatory disease. What is pelvic inflammatory disease? It's an infection that affects the reproductive organs of females. Reproductive organs like the uterus, that's the womb, or the fallopian tube, or the ovaries. And this PID is mainly caused by untreated sexual transmitted infection. Notice how I used the word mainly, meaning it is not just untreated STI that can cause it. Also, untreated bacterial vaginosis can also cause it. Yes. To explain it better to you, let's try to understand how the female reproductive organ is. The female reproductive organ looks like this. As you can see, there are two ovaries in the left and in the right. You can see fallopian tube in the left and in the right. You can see uterus, the womb where your baby will sit in if you're pregnant. You can see the cervix too, and you can see the vagina. If you have any STI that is untreated, something can move this STI from the cervix and the vagina up into the uterus or up into the fallopian tube, and this is where the problem is. When an infection gets to that part of our body, it can cause infertility. Let's say, for instance, this infection is at the fallopian tube. It will cause scarring, damage of the fallopian tube, and it's going to block the egg from being fertilized. It's just like saying if the gate to somebody's house collapses, picture a gate that collapses. There's not going to be entry or exit into that house until there is repair. So that's the same thing that happens. This fallopian tube is like the area where fertilization occurs. So if there's any collapsing or if there's any inflammation or scarring in that area, my dear, fertilization is going to be very impossible. My goal is to break down health topics to the lowest and simplest terms, so that you will not say, I did not know, or I didn't hear about it. I like bringing health tips to your doorstep because I believe that once you're very healthy, you can excel in other aspects of your life. Tap on that subscribe button to get more and latest information from me. But trust me, once you're able to treat this PID, you can have your baby in peace. Do you know that some ladies have what we call asymptomatic PID, meaning that they can have this infection and they will not know. It's either they don't have symptoms at all for many years, or they have symptoms but mild symptoms. And some others have intense symptoms like experiencing fever, abnormal vaginal discharge, or even bleeding between periods, painful intercourse which is not normal, severe lower abdominal pain. If you have been experiencing 3 or more of these symptoms I just listed, it's time for you to go and see your doctor because it might be signs of PID. Severe lower abdominal pain. Abdominal pain can be either in the right and the left. Heavy and abnormal vaginal discharge. Now, this vaginal discharge might be discolored. It's not compulsory, but most times it usually has foul smell. There are some tests that can be done to check if you are safe or not. Yes, there's some lab cultures that can be done, HVS and the rest. People normally mistake UTI for PID. UTI is just a baby where PID is. Like UTI is an infection in the urinary tract. You know, your urinary tract is in front. Your urethra is where your urine comes out from. That one is different. Just like every other infection, PID is treated based on severity. For minor infections, we normally use antibiotic tablets and pain reliefs, anti-inflammatory tablets. For severe cases, we normally employ the use of intravenous antibiotics. You can go to the hospital today and save yourself. You can go to the hospital today and find out you have an STI. You did not even know it was there. It happens. As if people come to the hospital and they do a lab test and they be like, how did this get here? When they look at me and ask that question, I'm also asking them, you should have the answer of how it got here. So go to the hospital today and so please, Ejo. That reminds me, have you liked this video? Please, if you have not liked this video, just like the video. I know you are enjoying what I'm saying. Just like it. You can also turn on the notification bell so that whenever I drop a new post, you will be the first to get it. Thank you for watching. Bye.